All right. Well, I'm here today. I'm Dr. David Hargroder here today with Miss Barb. And Barb, why don't you tell everybody just a little bit about yourself? Barb Brightwell, for those that need to know her last name. Tell me a little bit about yourself.
Well, let's see. I am a retired RN. I have been retired for about 5 years, maybe. I am a wife and a mom, and I've had the pleasure of watching Dr. Hargroder with a lot of his patients, and found that I was in a position where I was quite overweight and having a lot of health problems and developed rheumatoid arthritis. I had a stressful job. I kept putting weight on and just decided I need to do something about it. So that's in a nutshell.
Yeah, so we started off kind of working together. You
We
were in
did.
administration, and I don't know if you. I'm sure you were a floor nurse at some time, but I don't know that we worked together as a floor nurse. I just worked
No,
with you in
just
administration.
just
So
in this.
was it seeing the patients come through the hospital that had the surgery? What was it that first caught your attention or got you aware of the mini gastric bypass?
Seeing the patients come through, and I think we worked together for off and on maybe 20 years
Yeah,
or so.
long
And
time.
yeah, long time, and just watching. And as the years went by, I started having health problems and gaining weight. And I am one that like to succeed the or see the outcome and the successes of something. And I took a long time to decide what I needed to do, and didn't have a lot of luck with a lot of other weight loss methods, Weight Watchers, counting calories, Noom, all those different things that you can do that I can't even remember anymore. And nothing really did
I'm
what
sure
I,
you lost a lot of weight with all those programs. The problem is you just gain it all back.
yep, that's exactly right. And the last
Yeah.
thing I did, Dr. Harger, was I did one that, and I think I did it for 6 months and I lost 20 pounds. And I was so frustrated because I weighed 281 pounds. That's
Mm,
my highest weight. And I'm
yeah.
only 5'2" and a half, 5'3". So I just didn't feel good. My arthritis was out of control. My blood pressure was going up, aches and pains, and couldn't get around well. And anyway,
So you had your surgery when? What year? Do you remember how
21,
in 20
2021, June 2nd of 2021. So it'll be 4 years.
4 years coming up in a few months, huh?
Yes.
And what is your weight now?
It runs about 154, 155.
Okay. And
And
how
I
do you
got,
feel about that? Is that kind of where you want to be or wish you had a little bit more off?
I wish I had a little bit more off. You told me that you could get me to a certain place, which you did. And I think my lowest weight was 141. And you told me to expect to gain, I think if I remember right, about 10% of what I lost. And so pretty
You're
much
kind
did
of right
that.
there. Yeah.
Yeah.
Yeah, there's a certain advantage to being slightly overweight as opposed to being underweight.
Yes.
So my goal is always to get patients to a healthy weight, but not to
Right.
necessarily make them skinny. And then if you want to lose that extra 20 pounds or so, then I'll work with you to help you do it. But it's going to be more than what the surgery can do. You know what I mean? It's got
Exactly.
to be beyond that.
Exactly. And I will
So
tell you that to consider that I just turned last week, I just turned 69. And so I thought, for my age and everything, I think I'm been very, very happy, very
sure.
done very well.
Well, and the surgery does tend to turn age back a bit and help people live longer. So you're certainly looking wonderful at 69. Tell me, you talked about a lot of aches and pains and health issues. Um, how are those things compared to now? How's the pain? I know the surgery doesn't get rid of your rheumatoid arthritis, but how have the flare-ups been? How's the pain been? And what other comorbidities did we address with the surgery?
Oh, Dr. Hargroder, I know you don't get rid of the RA, but before the surgery, I was having a lot of trouble controlling my rheumatoid arthritis. And I was on a couple oral meds and I was on an injection. And that pain has completely gone away. Most days I don't have any. Um, I am down to, I take 2 pills every day that has nothing to do with weight. My blood pressure med's completely gone. I had sleep apnea. I don't use any sleep apnea machine now. Um, let's see. My arthritis meds, the only thing I take, and I've decreased the dosage from 200 milligrams every other week, giving myself a shot to keep my RA under control. And I now take 150 milligrams every 3 weeks. Um, the RA meds are hard on your liver. And I've completely just the other day had my first lab work that my liver enzymes were normal, my blood pressure's normal. I knew that one of the big things that prompted me was I knew I was heading towards diabetes. And all my lab work has been fine. Um, it amazed me when you took me off my blood pressure medicines the day of surgery. And I thought, oh, I don't know, is this going to work or not? But it sure did.
Yeah,
So, but as far as energy and so forth, I mean, it's been great. I wish I'd have done it sooner. It took me probably 6 years to get the nerve to do it. So,
sure. Yeah, we hear that from a lot of people. Their
yeah,
biggest regret is not having done it 10
yes,
years earlier.
I
Did you
feel
have
like
any
my life.
did did you have any unexpected results or benefits from the surgery? Things that maybe you noticed that you weren't even looking for?
Well, um, people telling me that I look 10 years younger or people not even recognizing me.
Uh-huh.
I ran into somebody the other day and a pretty good friend that I, through my daughter, our daughters were friends, and she didn't know me. And it took me a while since it's almost been 4 years. I'm not used to that anymore. And I finally had to introduce myself. That was unexpected. Just being able to get out and do things. My husband and we were walking one day. We went to the zoo in Springfield. And I kept up with him, and he's 6'2", a foot taller than me, and has a much longer stride than I do. And I did just fine, and that was unbelievable. Um, we flew to Alaska a couple years ago, and I didn't have to be worried that I couldn't fit in the seat or the seat belt actually fit.
Yeah,
Those are really unexpected things, and I didn't do it for um, the looks per se, but that's been a very unexpected thing for me because now I can go in and I can find things to fit me and I don't really have to worry too much about it. And
right.
that is awesome. Um, but the joint pain, you know, no real pain. I mean, I'm 69, so I do have aches and pains if I work out in the garden or something that I
Right.
don't normally do, but nothing to really slow me down.
Yeah, that's awesome. That is really awesome. Well, do you have any words of advice for anybody who's considering having weight loss surgery, but maybe I'll try diet and exercise one more time, and any advice for those people?
I tell everybody, of course, everybody wants to know what you do. And I feel very strongly about this, and I haven't really talked to you about it. So, but I'm going to say it anyway. This weight loss surgery was important to me, this type that you do, because it's reversible. I didn't want to go through something and hear later that I needed to have something reversed, and my my stomach was parts of my stomach was gone, or my colon or intestine was gone. Didn't that I had been in the weight loss arena when I was a younger nurse, not in, actually taking care of weight loss patients in the early 80s. And it
Hmm.
was quite extensive surgeries. Um, they didn't do well. They just didn't do well. And this has been something that I took a long time to look at and ponder and watch the outcomes and know that it's reversible. If something happens that I needed to have it reversed, I could, and I still have everything that I'm supposed to have in my body. So
Yeah.
that's what I would tell people. Do your due diligence, look at things, find out complication rates, find out how the surgery's done, what kind of recovery you're going to have to go through, and then follow the rules when the doc gives you those post-op instructions. I did actually watch enough patients that it would be maybe they were a little bit more painful with gas pains after surgery than they anticipated. And I remember walk, walk, walk. The first thing you do is walk. And I walked all night long. I never threw up except my first time of taking liquid med, and I gulped it, and I didn't expect it to go down that way. Never had any other problems. And you just have to, it's not the easy way out, but it is something that has worked for me, that I've kept off the weight for as long as I have, and it's changed my whole health, uh, you know, status at this age in my life. And that's what I would say most. Not every weight loss surgery is the same as this, and
Yeah. I
that's
think that's an
that's
important
something
point to make.
very important,
Not that we ever
very
want
important.
to reverse a surgery, but knowing that there's that exit strategy, you're not the only one
Exactly,
that's told me that that was one of the key features of the surgery that sort of
exactly.
swayed their decision.
Well worth
Well,
it.
one last question is what would you say has been like the most rewarding aspect of the mini gastric bypass journey so far? Could you name, is that too broad of a question, or what, how would you
Getting
answer
my
it?
life getting my life back, not being short of breath when my husband and daughter and son wanted to go on a walk and I had to sit down. One of my pictures that I have pre-surgery when I was so heavy. I mean, I couldn't walk. I
Hmm.
mean, I couldn't breathe and walk and keep up with people. And I actually climbed a glacier in Alaska with my family, and I did every bit as good as they did.
Wow.
And that stuff is, it feels so good to be able to do that and feel like you're not, well, I can tie my shoes. It was hard to bend over. When my arthritis would flare, I couldn't get out of bed on my own. I mean, all that stuff is gone. And I feel like I can do whatever I need to or want to do.
Right.
And it's just a new approach and outlook on life. And I'm more involved in church activities and community. And I just feel like that for my age, I'm doing really well. And
Sure.
that has been the biggest thing. I want to be around for a while to hopefully have some grandchildren someday.
Yeah, for sure. For
So
sure. All right, Barbara. Well, thank you so much. I appreciate you taking the time to do this. And
you are
don't be a
welcome.
stranger. Come around the office or give us a holler. We'll go have lunch or something.
That sounds great. And I would tell everybody that as far as follow up, um, for you, that meant so much when the first week you're going to you'd be expected to call every day. He's going to keep track of you. You have follow up appointments. Don't not do those because every time I go, I learn something.
Yeah.
So you kind of get into a routine and you forget certain things. So just take advantage of all that and I don't know, take your health in your own hands and do something about it. That's what I regret most of
Nice.
packing all that weight on.
Perfect. All right. Well, thank you again, Barb.